My name is William Applegate. I go by Bill. I'm the Director of Government Relations for the American Society of Transplantation. I've worked with the organization in this capacity for the last 2 decades. For years now, we've been working with other stakeholder organizations in the transplant arena to advance the Living Donor Protection Act. This is a bill that would remove any kind of discriminatory nature by life, long-term, and disability insurers, and just to ensure that what AST has always done in the public policy arena, which is sought to remove any financial or policy hurdles that might prevent somebody from giving or receiving a donated organ. I think, as they say in Washington, D.C., all politics are local. People really do, elected officials, either at the state level or federal level, they do depend on their local constituents, voters. And so I think knowing that all politics are local, the grassroots piece is really important. As lobbyists and government relations directors for the organization, we do a lot of work, shoe leather, running around Capitol Hill, but at the end of the day, they want to hear from the constituents. So AST has leaned heavily in partnering with other organizations, but also within our own ranks with the patient community. So anything that you can do if you haven't touched base with your 2 U.S. senators and your 1 House representative, then please do. Let them know that legislation like the Living Donor Protection Act is key. Advocacy is so important. There's a saying in Washington, D.C., and that is that if you're not in the restaurant, you're not at the table, you might be on the menu. So it's very important to dictate and to have a voice, eyes, ears, and boots on the ground in Washington, D.C. and in the state capitals, advocating for patients as we do.